On page 3 of the document, we document the patient's admission details. At the top of the page here, there is space to document the patient's name and hospital number, or we can affix the patient's addressograph label here. So remember, each page of the document has to have the patient's name and hospital number attached to it. The name of the ward that the patient is being admitted to is documented here. Their resus status is documented here. The name of the patient's consultant, date and time of admission, predicted discharge date, and predicted length of stay. The date and time of readmission then is documented here if this patient is been a readmission, if they have been discharged within a week. Sacrament of the sick, if the patient has received that, we document the date here. Here we have the patient's personal details, likes to be known as, their age, sex, religion, telephone numbers, occupation, marital status, and if they have any allergies. If they have any allergies, what reaction did they have, and was it diagnosed by the doctor or GP, self or other, and you can comment there. And if they have an allergy wristband completed and applied. So here we document the patient's next of kin or their preferred contact person, and we have is their next of kin contact aware of admission, yes or no, the relationship to the patient, address, mobile number, and are they advised to send any valuables home that the patient may have brought in with them. If there's a second contact or family liaison person, we can document their details here. Here we document the patient's presenting symptoms, the impression, what do we think is wrong with the patient, and once we know the diagnosis, we can document that here. Back up to the top of the page, where the patient was admitted from, the name of the patient's GP, and then information on the patient's medications on admission. So did the patient bring in their medications on admission, yes or no? Is medication list available and verified with the patient, yes or no? So we don't ask you to document a list of medication. The patient will normally have a list either from their GP or from their pharmacy. So if the patient has a medication list from their pharmacy or GP, just that we have gone through it and verified it with the patient, and we tick either yes or no. If the patient has brought in any medications of their own, we advise them to send the medications home, and we tick yes or no. So comments, we can write here if we have any comments in relation to the patient's medication. Perhaps they're on something significant like insulin or warfarin that we want to take a note of, we can document that here. The next section is the patient's infection status history. So does the patient need isolation, yes or no? Has the patient any diarrhea or vomiting, yes or no? Any respiratory symptoms, yes or no? Have they a history of any of these infections, or we tick whichever is relevant, or if there's anything else we can document here. Does the patient have a CPE card, yes or no? If yes, indicate the type. Contact or colonisation. So does the patient have any of these symbols on Clinicum that would indicate that the patient has a history of any infections, yes or no? Infection status discussed with the patient, yes or no? And infection status communicated to the multidisciplinary team. And we do this through signage on the patient's door. So yes or no. So remember, this is just the patient's infection status history. Later on in the document, we have an infection control assessment, which goes into this in more detail, and this needs to be completed on admission. So here we document the patient's previous medical or surgical history. At the bottom of the page here, you'll see documented in red, all care provided must adhere to policies, procedures, protocols and guidelines available on QPulse. So we'll go down to page 4, and here is the nursing assessment summary. So here you can document a summary of the patient's admission, that they have been seen in the emergency department, and what investigations or tests were carried out there, and what the plan is for the patient. So the nurse admitting the patient will sign here, and date and time. So all outstanding assessments and care plans are communicated at handover. So for instance, if the patient came in at the end of the nurse's shift and the nurse didn't have time to complete all the assessments and care plans on the patient, the nurse needs to hand over to the next nurse any outstanding assessments and care plans which need to be completed, and they tick here to say that they have done that. Here then is your investigation, procedure, appointments record. So if the patient is booked for any investigations, any appointments, any procedures, we can document the date that it was requested here, what the procedure is, and then once it's carried out we can document it here. And this is quite useful, so we can see at a glance any investigations that have been taken out, or any that are still pending. On the top of page 5 of the document we have the assessment tools log. So throughout the document there are various assessment tools, which most of them need to be done weekly, or some of them more often. So the idea is when you do your assessment, you come back to this page, you fill in the date, and then you fill in the score, and you sign it, and there's a place there for the student nurse to sign it if it's been completed by a student nurse. So the idea of this is when you are taking over the care of the patient, you should be able to glance at this, and you will be able to see when for example, the Waterloo score was carried out last, and you'll know then whether you are due to do the Waterloo score again on your shift. So it's a handy tool if it's used properly. It just saves you having to go through each assessment tool and seeing what date they're due again at. You are able to look at this at a glance. And then the last part of this section is the discharge planning. So the discharge planning assessment should be undertaken on all patients on admission and completed within 24 hours. So we're looking at the patient's home circumstances and current support at home. So the discharge plan discussed with, so we document here, did we discuss it with the patient, a family member or other? And the family or patient should be informed of the 11 AM discharge time on day of discharge, and there is a discharge booklet given which is available on the wards, and we tick here to say that we've given that. So what type of house has the patient got? Is it a bungalow, 2-storey? Do they have a bedroom upstairs, downstairs, a toilet upstairs, downstairs? Do they live alone? Who do they live with? What is their relationship to whom they live with? And do they have any dependents? What services have they got at home? Have they a public health nurse? If so, how many days per week? Home help, number of hours, any informal support in place? Meals on wheels? Do they have a pendant alarm? Have they any equipment in place already? And do they have a home care package already? And we can comment on that. Do they have a community psychiatric nurse available to them? A community palliative care nurse? Day centre, hospital, hospice? Do they receive respite, and how often? Does the carer have any needs? And their local public, who is their local public health nurse, and what centre are they based at? So are there services already in progress? Yes or no? Is there a request for services required? Yes or no? And is there a request for equipment required? Yes or no? And we can comment here. So has the patient requested Long-term care, yes or no. Respite, yes or no. Home help, yes or no. So if yes to any of the above, have the relevant members of the multidisciplinary team been informed, yes or no, so specify. And then here we can document the patient's inpatient MDT referrals. So we tick which member of the multidisciplinary team they've been referred to. If it's an advanced nurse practitioner or a clinical nurse specialist, we document which one it is. Maybe it's the care of the elderly, and then we document the date that they have been referred.